Recording in progress.
Welcome to the October 6th, 2025 meeting of the Yarmouth Board of Health. This is a hybrid meeting, and people need some instructions of how to join us. It's on our website if you were unable to make it here into the town hall. So let's see about some attendance. Eric, are you here?
Here.
I'm here. Larry?
Here.
And Charlie's not going to be here.
Correct.
And I think Mary's out there in Zoom. Is that correct? Are we on mute?
We see you waving, Mary. We can't hear you.
Unmuted. You have to unmute me.
Okay.
We can hear you now.
Okay. Welcome from home or wherever you are. Okay. So we have a quorum. The meeting will come to order. And before we go to public comment, actually, we have a nice big event here tonight. And Sarah, you want to take this over?
Sure, if you guys want to come up to the table, if you want to, yeah, sure. Or Julie can do that if you would like to. So we had a September Awareness Month. The Board of Health is now doing an Awareness Month each month. Last month was childhood obesity. And we had a coloring contest, and we sent that out to the schools, to the libraries, and in Town Hall. And we had 46 drawings returned to us. So we picked the first prize, second prize, and third prize. So Julie won the second prize, and she's here to claim it, which we're very thankful for her for coming in. So we'll give you her gift card and a snack bag that was donated. And thank you so much for participating. We really appreciate it.
Nice job.
Don't I get something? Don't I get something?
We'll get you a snack bag before you leave.
You guys don't have to stay for the rest of the meeting.
Yeah, I will give you a few other things, but we just thank you for participating, and we hope to continue to do these events each month and bring awareness to the children and to other people as well. So we really are excited that everybody participated. So thank you for taking the time to do that.
Thank you.
47 we received, yep, so you did really well. Yeah. So thank you. And I'll follow you up because I'll get you a bag for him. Okay.
You live in Yarmouth?
In Dennis.
Dennis.
I'll get you something.
All right, have a great day.
Thank you.
Thank you.
Okay, number 3 on the agenda is public comment. If it's opportunity for anyone in the public like to come forward here or from their remote site, please just come forward. Any questions, comments?
I don't see anybody on Zoom.
Okay, we're up to number 4 already. That's the pesticide use on town property. I had just mentioned, put this to the agenda to try to keep the issue alive a little bit.
Yep.
We had sort of decided not to move on, I guess, the bill that was going to go to Boston. It was complicated, and I just thought we ought to try to do something to move forward on a big problem, but a complicated one, certainly, to educate, enforce it, and so on. Now, in the packet, okay, Barry, you had put in, I think, the state regs.
Yep, state regs are in there. We have those. And then also, I tried to get Lori Razula from the water department to come in, but she was busy. She did send an email. I'll read it out to us.
Great.
Hi, Barry. Thank you for looping me in on this. The use of herbicides and pesticides in groundwater protection area, Zone 2, is heavily regulated by Mass DEP. Therefore, from a drinking water perspective, a local ban would have minimal, if any, impact on drinking water. I know a lot of people are concerned with Roundup, so I checked for the active ingredient in the state drinking water quality database, which includes over 30 years of data, and all results from across Massachusetts were non-detect. I am not able to, so she's just not able to be here. I don't have strong feelings on one way or the other regarding the local ban on herbicides and pesticides. So that's from the director of the water. So they, again, with the town, DPW, the school, and the Parks Department, and the golf courses, they all follow the state DEP regulations to a T. They're highly regulated. And again, it's the local public, myself, yourselves, that the ones that are using the Roundup incorrectly. All the big players know they're licensed and certified on how to use it. So I think, again, education to the public is a must for us. So we need to try to figure out how to get some wordage out and some education out to the public on herbicides and pesticides.
Barry?
Yes, ma'am.
So 333 CMR 1200 applies to private citizens as well as municipalities.
Say that again, Mary. I apologize.
Does this regulation apply to private citizens as well as municipalities or retail business organizations?
I think this is just municipalities. I'd have to look at it closer. I don't want to.
Oh, it says public
Public.
drinking. Does say public drinking water.
Public drinking supplies.
Right, but it doesn't say
That's
who is, I
who it-
mean, talk about pesticides being regulated, although it does not give a list of it doesn't show the groundwater protection list, number one, but it also doesn't say who is regulated by this.
yes.
What entity,
I can. I will reach out to the state and find out.
it does say any person, under record keeping. But I'm just wondering if it applies to private citizens as well as, people in the profession like landscapers and people like that. Okay, thank you for finding.
Thanks, Mary.
Yes.
My understanding is that that it really pertains to the commercial application of products. I suspect that by law, by actual definition, the homeowner is supposed to comply with this, but the Department of Agriculture doesn't have the resources to intervene on that scale. Therefore, they're, when they track pesticide use and things like that, it's really the commercial application. So anybody with an applicator's license, school properties, town properties, golf courses, I'm sure that their intent was to have everybody follow it, but I think it's really geared towards the commercial application, people out for hire.
Okay.
So how is it enforced, Eric?
This is just a portion of the regulation, but pesticide applicators have to pass an exam. There's 3 different levels of licensure. There's a dealer license to be able to sell and distribute product. There's a regular applicator's license, and then there's a private applicator's license, which would be for really agriculture, privately owned property. So one tier of licenses to sell, one tier of licenses to apply on somebody else's property for hire, and then the other tier is for private golf courses and privately owned farms, things like that. So, first the license holders have to test and pass an exam, and on an annual basis, they have to submit a pesticide use report outlining what they used, how much of it they used, and weather conditions, things like that, and that's all reported to the Department of Agriculture. And in addition to that, licensed applicators have to complete ongoing training and submit continuing education units. Does that answer your question?
Very much so. Thanks a lot, Eric.
So that would include small businesses in town that are taking care of people's houses, the
Yes.
properties. That would include.
Yes.
Management stuff, yeah.
Okay.
But where it doesn't, I think it's kind of a gray area, if you went out and bought a product and applied it to your own lawn.
Right.
I don't want to speak incorrectly. I don't want to say this doesn't apply to you, but it might be a bit of a loophole or a gray area.
And certainly not enforceable.
Right.
They did something about the sale of these products.
Or
Only,
Mary, I lost you there for a second. The last part of you.
it would be unenforceable for private citizens unless there were something that didn't permit the sale of these products to anyone but licensed applicators, dealers, or someone on a privately owned property.
Yeah, I'd agree. It would be education and it would be an ethical issue, I guess. Now, just to remind everyone, our bylaws can be more restrictive than state. We went
Yes.
through this with tobacco, for instance. What happens with town properties that are not the golf courses, not the school? What about playgrounds, or what about around town buildings? What is being done there with? I'm more concerned about herbicides than just general pesticides.
So again, that's under the DPW, and they have the same restrictions they have to follow within, even if it's not within a zone 2, they follow the zone 2 regulations outside of even the zone 2. So here at town hall or the public libraries, the parks and stuff. But I'm not for sure what kind of applications they're putting down. I can ask about those too.
For sure. I mean, do we need herbicides put down on cemeteries or on the playgrounds? I mean, is that something that we want to take place or not? Part of it is, I guess, aesthetics, I guess, versus some health issues.
Barry, are you aware of any, formal training for these applicators that work for the town? Do they go through a formal
Yeah,
training
like Eric said, you have to take a test and be able to
And
pass a
there's
test.
records kept of their usage
Yep.
and dates and that sort of thing. It's very similar to probably what we would have to do with the DEA type of.
Sure.
Yeah.
So every application that takes place, the licensed applicator is required to keep a log of the date, the product, the amount used, the weather, the time of application, and then.
It's inventory, probably.
Yeah, and then at the end of the year, they would sort of compile all of their applications
Okay.
and divide them by product and submit an annual use
Okay.
report.
Yeah.
So,
So actually, it's more regulated even than the DEA because we're required to keep records, but unless they come and investigate us, we don't have to submit
Yeah.
a use
Right.
form at the end of the year. We just have to keep records of our purchases and our usage.
Like Scott was saying from the local golf courses, that there's only 6 of them that have the qualifications, credentials to do it, and they're the only 6 that are allowed. They're not even their part-time help or anything if they can't touch the stuff. So they're the only
Apply
ones.
to non-golf course location.
I'm pretty sure that it would be the same thing. You have to be a licensed applicator.
So the same group that would be applying products to the golf course are the ones who are doing the parks and
No,
cemeteries?
no. The DPW has their own licensed applicators. I can find out how many they have too.
What I'm asking is, at other sites in town, non-golf course locations, are the people who are working on the golf courses, the trained people, are they applying products elsewhere in town?
Not the golf course people are. It's the DPW has their own staff. So I'll find out how many applicators DPW has.
Yeah, the DPW should have their own staff members that are licensed,
Yeah.
but by law.
Well, yes, oh, for sure.
Yeah.
I mean, they gave a great presentation with details and so on. I'm just asking if those are the same people who are working elsewhere in town.
No, the golf courses is separate from the
Right,
DPW.
those are my
Yeah.
impressions. The question is, people who are bringing products down, who's following that? In other words, who's doing the applications in other sites? That's all I'm asking.
I would think that we could request that.
Yeah, I could find out. That's an easy request.
If I remember correctly, the report we got on the schools in town, they claimed that they were not applying any Roundup. Do you remember that to be correct?
Yeah, no, you're right on that.
They may
yes.
be using other herbicide.
For sure. I mean, you look at the grass,
Yeah.
I'm sure they are.
A lot of the herbicide is mixed in with fertilizer, so it might be a twofold application, similar to a Scott's product, step 1, 2, or 3. That wouldn't be Roundup, but it might be another type of product.
Yeah, I wouldn't address it just to one product, yeah, and you kind of educated us a little bit on that.
This regulation pertains to protecting groundwater sources of public drinking water. I know about our APDs, but because the Cape has a sole source aquifer, does that apply to the whole Cape?
I'm not for sure. I'd have to do some further research into this.
And again, this whole thing came up because of the home rule petition, because the state has said that they are the only ones who can regulate this. And this whole home rule petition was to allow municipalities to regulate.
So I just want to jump in there. I did a fair amount of research after some of the earlier meetings, and there are some other groups that have been advocating for other bills or petitions similar to what this home rule petition was. And there was one in particular that's gone to the state several times, and it was put forth by the NOFA, which is the Northeast Organic Farming Association. And this, I could find the title of the bill and send it out to everybody, but it was specifically written to restore local authority. So it was a little bit different than the home rule petition that we saw, because the home rule petition that we saw, I didn't understand it as necessarily restoring local authority. I saw it as more or less a restriction of application with the opportunity to request exemption. So now that's not to say that it's going to have any more traction when it gets to the state level.
Yeah.
But there's certainly larger groups that are advocating and have been advocating for it. So my understanding is that the only real power, authority that we have is to, we have some say in what takes place on town property.
Right.
And that's it.
Yeah. It's not just drinking water. I just have this image of, kids playing on the soccer field and they're, licking their hands or whatever, wet, and they're throwing it, and just brings the product right to their mouth. Or just think on TV, you watch the quarterbacks playing. The quarterbacks typically are putting the hand in their mouth before they get the snap. So it's not just drinking water. And it's something I'm concerned about, just the toxicity of what's down and affecting people. So, Lori, I mean, she's on target about the drinking water for sure. So, for the small businesses in town, then, it's their responsibility to contact the state. So, on the town level, we don't know who has a license to apply the products. That's where things are.
It's public information, so you can look up licensed applicators. So it's out there,
Yeah,
but
it's-
no, we don't really know. You can search by name or by
Yeah,
business name,
right.
but no, we really don't know.
Okay. Okay, I don't know. Any other thoughts, anyone? I just, Eric, anything else that just,
I mean, I share some of the same concerns you do about kids going out and playing in sports field and licking their hands.
yeah,
The school properties are more heavily regulated than other town properties. Application timing is very specific, and it
sure.
has to take place when students are not present, and there's a period of time that must go by before students can re-enter. And, hopefully, everybody's in compliance with that. But I'm certain that there are products going down there, and
Yeah. I just have the image in June,
so.
everyone applying stuff for their backyard.
yeah.
To get ready for a beautiful lawn for July 4th, and then you got kids in the backyard playing around and dogs rolling around in it also, that's all.
I mean, I do believe that we have the authority to make some type of a statement if that's what the board feels they want to do.
From my perspective, looking back over my career, I've certainly seen a lot of dogs that I suspected had a toxic gastrointestinal reaction to pesticides. However, it was a very acute attack from a very recent application. And I'm unaware of any cases where I was seeing patients that were affected by an application, say, more than a few days afterwards. So that's just from my experience as a veterinarian. I mean, I certainly feel like I saw some pretty sick dogs, acute gastroenteritis cases, even neurological cases that I may attribute to a pesticide or insecticide. A pesticide and it is also classified as an insecticide as a pesticide, as a
Yeah.
herbicide, and that sort of thing. So we never did any forensics on these cases, but I certainly felt like we had enough sort of circumstantial evidence and anecdotal evidence to feel like these animals were exposed to toxic effects. And it was certain dogs, certain animals that seemed to really ingest a fair amount of grass or things that they would pick up in the yard and that sort of thing. But as far as, I don't recall any cases more than that were sick subsequent to an application, beyond 3 or 4 days. So I think that all these products are pretty much water soluble, right? They just break down fairly quickly, or they break down very quickly.
Yeah, I mean, I don't know what there's a term called half-life,
Right,
for
yeah.
how long it stays
Sure.
active in the soil.
Half-life would- Sure.
But, I think for our concerns here, we would be talking about fungicide, herbicide, and insecticide.
Yeah.
But, it's the school of thought, I think, is starting to change. People are, I seeded my lawn my backyard this summer. I did one very light fertilizer application. I have no weeds. It's beautiful. It's, good cultural practices will promote healthy plants, and healthy plants can ward off disease and pathogens. I'm not suggesting that, I think the golf course is doing a good job, and they have pretty strict standards that they have to follow, but, I do have some concerns. You apply an insecticide and basically nuke the whole yard, you're killing beneficial organisms and
Yeah.
harmful organisms, So
That's not gonna go away, I don't think.
probably not.
Yeah.
But I think, that's where the education piece, I don't know what we can do with education, but I think a little bit of education will go a long way if we can maybe start to do some of that. People, you probably have seen red thread in your lawn. The grass turns pink in the spring. Have you seen that before?
I don't recall.
No.
Well, when it gets humid out, the lawn gets red thread, and the people's first reaction is to go get a fungicide and put it down. And, the grass will grow out of it in a couple weeks. You don't need a fungicide application. It's not the green it's not the putting green on the golf course, So, I don't know, overwatering causes fungus. I mean, we all see the sprinklers going at all hours. So, some education and cultural practices can really go a long way.
Right. The other thing that concerns me is, we're aware that there are,
Excuse me, you may want to speak closer to the mic. I'm not sure it's picking it up.
the other thing that concerns me is that we are kind of generalizing all these pesticides, but yet we don't really have much factual information as far as the individual pesticide effects. So I feel like we may be sort of getting into an area that's beyond our purview by trying to legislate this sort of thing, That's sort of where, at least from my perspective.
Well, when we think about it, how best to educate people, including ourselves, if there's some groups out there that have some ideas that we can take a look at, that would be great.
And would it be worth bringing in somebody who is an applicator from the DPW or the school to?
We reached out to them. They to have them come today, so they were busy.
Okay.
We'll give one more shot at it, okay?
Yeah.
Just
Well, we
request
could
next.
certainly request their report or their application log.
Sure. You could probably interpret it for us. Okay, great. Mary, anything there?
Nope.
Okay, all right, so we'll move on to the plastic product waiver form review. And one thing, Mary, you may not be aware of because you don't have a hard copy. I had made one edit on it or suggested it.
I have the hard copy.
Not
Right,
the
but
current.
we're having a correction made here tonight.
She have
I can tell you what it is, assuming everyone agrees or not. On the second page, you go down underneath duration of waiver requested. Underneath there's 3 lines, and all the way to the right on the third line, it says, please list as. And to me, it wasn't clear the way the number signs and commas or whatever would be. And also, I thought it's supposed to include number 5. So it would be 1 comma, 2 comma, 4 comma, and 5. You would know this better than I would, Mary.
It's not, number 4 is not one of the waiver ones. We went back and relooked at it.
Okay.
So it's on the new one that I highlighted, that I handed out.
Okay, it's here.
pass that down to Hillary.
I thought that was just an example. Please list as one, number two,
Yeah.
two, that kind of thing. That's what I thought that was.
Okay, so you're saying, I'm missing the point then. Why are there two number twos?
Two, they're listing one and number two plastic and two number four plastics. That was how I read it.
Yeah.
But confusing, I agree with you. If they're gonna, if you wanna do it that way, I'd spell out one, number two, plastic, two, TWO, number four, plastics.
Yeah, I agree. I mean, we're the Board of Health, we have a better chance of understanding it than just someone coming in with this. We have a lot of people gonna be sending in over the years, coming up for a waiver. So,
We do A, B, C then instead of 1, 2, 3.
Mary, what do you think's best?
No, why would you do ABC? What? You're talking about the plastics that you have numbered down at the bottom,
Yeah.
right? Which also I have a comment about, might as well make it now. Polystyrene is already prohibited by the town, so that needs to say that there. As a reminder, polystyrene
Number 6.
already, prohibited by the town, and put the date. So what you're saying is are you saying they can only request a waiver for number twos and number fours?
1, 2, and 5.
Okay, and five. So you have to put down five also. That's what you're saying.
We did change it on, we have a hard one. We'll email it to you.
Yeah, I mean, and also because if you're gonna list 3 different plastics that they want to get a waiver for, then, this relief is necessary due to, how do you put down, so underneath, do you put down for number 2, it's no suitable alternative for the cost, and for number 5, it's other, you know what I'm saying? You've got the opportunity to list it on the first page, but on the second page here, you're wanting them to list 3 different plastic, not give them the opportunity to put down what you want by way of relief purpose for each individual one.
Okay. I'm finding it confusing.
Can we just get rid of can't they just list the number plastic? Can we just get rid of 1, 2, and 3?
You're saying the ones that cannot get waivered?
Well, why do we have additional numbers? Please list as 1, period, number 1 plastic, 2, period, number 2 plastic, or 3, period, number 5 plastic. Can't it just show the pound symbol and the number plastic? It's confusing to have all of those numbers.
Right.
Well, don't have 1, 2, and 3. Just have number 2 plastic or number 1 plastic, and then have relief is necessary due to, and then number 2 plastic, relief is necessary due to, number 5 plastic, relief is necessary due to.
Right. That's certainly clear for me. Now, I don't think people necessarily going to know what 1 through 7 means. In other words, are those the only type of plastics there are? Or, I mean, there's no asterisk there saying why that list is below signature.
That is the list of plastics, yes, and they are marked on the container.
They're marked on the bottom of the containers.
Right, so.
No, I'm talking about on the bottom of the page. that information happens to be there, somehow maybe it needs a title above it. What are those? You know, what does that mean?
The
Are
list,
those
of,
the only-
list of different plastics. I mean, that
Plastics. Common types of plastic used in disposable foodware. Types of plastic used in disposable foodware. But then again, with the polystyrene, you have to say, and then I'd also say, for number 3, no waiver. For number 6, no waiver, of course. Well, number 6 and number 7, no waiver.
Good point, yeah.
You know, so that because otherwise they're going to look at the list and think they can get a waiver for any of these.
Can I just interject for a second?
Anytime.
Okay, so would it be helpful, to Mary's point, where if we just take that section where it says identification code number, product is included, the reasoning that they're asking for it on the front page, and just put those checks box underneath each line item and say why they're asking for the waiver. So under number 1, for each product above, answer the following question. What is the product used for? Number 1 would be high-density polyethylene, and the reason we're asking for the relief would be one of these items, and it would be all in that same block. So they're answering the question, they're identifying what the product is, and they're identifying why they're looking for a waiver. So would that help?
When you say product, are they going to think the plate, or are they going to think of the type of plastic?
The plastic, so they have to identify, like to Mary, say the types of plastic used in disposable foodware. That will give them the list here. You know, you could say refer to list below.
Right, or just an asterisk to go on the next page down
Right.
there and
just
find
kind of
it.
get rid of this section here and include it as part of what they're filling out, if that would be helpful.
A bit less confusing. I think.
Okay. I mean, I'm just trying to, so we just want them to identify the product name and then explain what they're using it for and why they're asking for a relief. It would all be under one umbrella rather than as a separate check mark on the back page. We can redo that.
Wait a minute, a separate check mark on the back page?
Get rid of those check marks that are on the back page and put those on the front page where it says
Right.
number 1, you would have the reason that they're asking for the relief, and it would be one of these reasons per the regulations. And it would be under that, you know,
Okay, but then where do you have them put the number of the plastic that they're,
the product name, the plastic product details on the first page. So their product name would be number 1, cost per unit, monthly quality, in the material. And then this,
I that on my form here.
I'm not sure which one.
Says, for each product above, please answer the following questions. What is each product used for? Why is this product essential to your operation? Are there health safety reasons for its use?
Correct. And then in that same block, we would put, why are you know, relief is necessary due to what reason? And it would have to be one of the regulated reasons.
And so where are you putting the type of plastic, though, that they're asking relief for?
On the top section, the plastic product details. So it would be the product name. Do you have that? So it says business information, and then the second section says plastic product details. Does yours not have that?
This information, plastic product details.
That's where they would list the type, or we could add a type of product where it says material, so it would,
I put material, I put type of plastic, and then put by number,
Great, yeah.
okay.
because it's not material, the type of plastic,
Okay,
okay?
yep.
And you could say, by number, but, you know, that's what you're gonna list on the second page.
Correct.
Okay. Okay, yes, I think that would make it clearer.
Okay, we will, Riley and I will make those adjustments and resend out to the board.
Great.
Good.
So who makes the final decision? Is this just something that Barry would deal with?
Oh, I'll bring it to the next meeting.
Yeah, we have time before all this goes into effect.
No, but I mean, each applicant,
If he's gonna,
Yeah.
once they fill this out, then, do they have to come before the board, or you?
If it's small and I can do it, or Phil, but if it's a larger one, we'll bring it from the board.
You'd certainly be able to sort
Yeah.
the issue out that we're talking about right now, yeah.
It's the same with the septic system. If someone kind of needs a variance, it's a very simple routine one. We don't see it.
Right.
I mean, the health department
Right.
takes care of that.
Sure.
So it's complicated.
No, what my point was that rather than belaboring all this, Barry's gonna pick up any issue with the application when he sees it.
Exactly. You just want to make sure the person filling it out knows what they're filling out, and then, so you don't waste time making phone calls and trying to interpret what they wrote. That's all. You have enough on your plate. Okay. Anything else on this, anyone?
oh,
Okay. Mary, thank you again. Want to do some reviewing of and approving of minutes? Come on, let's go for it. Okay, looks like we have one set, September 15th, 2025. That was in your packet. Anyone? So any edits to it?
I didn't see any.
I didn't. Okay. Anything in that, Eric, Mary? Hey, Eric. The motion? Come on, go
Sure.
for it. Let's go.
I move we approve the meeting minutes from September 15th.
I second it.
Okay. Let's skip if anyone has any comments. Let's just go and vote. Just raise your hand and say aye if you're in favor of
Aye.
passing it. Yes, they're accepted. Mary, which way did you vote?
She raised her hand.
You did, okay. Great. Okay, new and old business, and there are also a couple of things in the packet here. So why don't we start with this? Sarah? You want to
Yes,
start
okay,
here?
Sure, yeah. So as we saw, we had the September awareness, and now we're moving on to October. So we are asking people to come in to fill out a pink ribbon, and we'll display those onto town property here. We'll probably replace the colorings with the ribbons now going forward. We will also be giving out pink light bulbs, which we did today with Cape Save has donated generously 200 pink light bulbs. And we went to the senior center today and sat there for a bit with Cape Save. Ryan McCluskey, who's a very, very nice man, and will also be coming here on the 10th of October to give them out at Town Hall. So the first 200 residents of Yarmouth pick them up and display them at home, take a picture, email them to the health department, and we'll put them on the the website and hopefully on, some sort of social media, just to show support for the breast cancer awareness, which is October. And then the town hall staff is going to be wearing pink on the 17th. So if you come into town hall, please wear a pink shirt. So we're excited. September's awareness month went well. I think we had some great participation from the children in the schools and bringing awareness. And so each month we're going to learn from what we're doing, and very exciting, bring fun stuff to, health awareness.
Thanks for all the work. That's great. Barry, you want to take us through a few of the things in the packet here?
Yeah. In your packet, you have the rental pre-inspection checklist. We get a lot of questions from local homeowners of what we're going to be looking, our housing inspectors look for. So this is going to be available to all of them. It's not everything we look for, but it's a good guide of what to expect for the big health issues when they go through to do an inspection. So they're come a long way putting this together. When I first started, they didn't have anything like this. It was just kind of willy-nilly. Now Deb and Brian and Sarah and Riley, they have put together a great program. So, Riley, do you have any numbers on the rentals that you could give us off the top of your head?
Or how many are left for 2025?
Yeah.
It's under 30.
So under 30. And when we first started this program, we said it's not going to be perfect. We were hoping to have at least 20%, probably not. And we're down to 1%, almost less than 1% of people who haven't done it. And a lot of those are homes that have sold and new owners that aren't renting or don't realize that they need a rental permit. So Riley's sending out letters and getting lots of response back. So that's a huge shout out to Sarah and Riley up front. So
I have a comments and a question. How do you know, the affidavit, how do you know to whom, are you sending these out, or are you delivering them when you get a complaint that how is this being used?
the affidavit, that's if Riley sends out emails and letters. If they call and say we're not renting anymore or we're not renting, Riley will email them this and they'll send it back to us so they can come in and grab it and fill it out. Go ahead.
And actually, I'm sorry, this is, we've also added this into OpenGov, so it's actually now an application, similar to a permit or an application they can fill out online as well. So we've done that now this year. So it is sent, Mary, to your answer, out with the, if we get, question, it is mailed out with the application. But most of these affidavits we're not made aware of until someone receives the notification to ask them to renew they'll contact us and say, we're not renting any longer. So we'll now ask them to just go online and fill out the affidavit, or if they don't feel comfortable doing it online, we'll mail it out to them.
And thank you, that sounds great. The comment that I had is under the responsibilities for refuse. And I know you probably use, some other forms as a basis, but it says, as required by the municipality, but, we don't have any trash pickup by the municipality in Yarmouth. There's private trash companies, but there's no municipal trash pickup. And some of these things, like arrange regular collection and final disposal through a municipal or private system. And that's under owner requirements on the, responsibilities for refuse and duplexes and multifamily homes. So I think that municipal should be taken off, because people that are renting, they don't know whether we have municipal trash collection, but we don't. You see what I'm saying?
Yes,
It's probably a places, but this is the first place I've looked that didn't have one, but.
Good pickup. Yeah, I agree.
I think what we meant there was just to purchase a dump sticker, but we can tweak that to make sure they understand that a little bit better.
Right, separate than a collection of
Yeah,
something.
right,
Yeah.
right. Thank you.
Does that mean purchase a dumpster? What do you mean?
Purchase a disposal sticker from the town, arrange collection. I understand what you're saying. I'll definitely tweak that, but I think what we were leaning towards is making sure that people understood that we have a disposal sticker they can purchase and use that in lieu of a private.
Okay. Yeah,
Thank you, though.
nice work.
Yeah, that looks great. I just had a couple thoughts. One, do people who buy houses, do they get information that this is a requirement? In other words, they may be buying a house that someone already is renting on the property, or someone buys a house and wants to rent on their property. When someone purchases a house in town, do they learn about this or not?
And there's so many sales and transfers of homes that for us to track that it would be a task on its own.
I wasn't thinking of the town. I wasn't thinking of the health department. I was thinking, what happens when you purchase a home? I mean, I did this 30 years ago. I don't recall exactly where in the process that could be provided, that information.
Riley, do you have something?
I was just going to say for the properties that have had a rental at any point and then we noticed that there was a sale, I've been sending out letters to the new owner saying this once was a rental property. If you want to rent, and then we send them the application on paper and the affidavit and just say, if you don't want to rent, please fill this out and let us know so that we can update our records. And then we'll make notes that it was sold and they're no longer renting, or that they'll require a new inspection.
That's perfect. There's the answer. Great. Thank you. Okay. The other thing I was wondering, on the rental registration application, bottom it says the rental certificates expired December 31st, and then you need to register your property no later than April 1st. Are there any issues there of a 3-month gap that are problems where people may be renting, but they don't have it, the owner doesn't have an active license?
Yeah, I mean, I mean, we try to catch them. Now, I think with the short-term rental, where that's being inspected annually now, whereas before it was maybe every other year.
Sure.
I think we're catching those a little bit. You know, short-terms are usually the issues.
Yeah, I would think so.
So those, now because those are required annually, I think we're gonna see less of an issue with that, hopefully. But yes, there are, you know, people that do wait until, because they're not here till the summer, so they're
Right.
like, well, I didn't know I had to renew. But, you know, overall, we just try to, like, to Barry's point, we're
Okay.
trying to catch as many as we can, you know, just to make them aware. And I think the more we send out notices and emails and stuff like that.
Great. Well, the other is the issue which probably most people here don't think about too much, and that is the idea that on the smoke and carbon monoxide detectors, not everyone can get up on the ladder and change it every 10 years or change their batteries, hopefully, on an annual basis. That's something to think about. What should a person who doesn't feel comfortable because of a disability or just based upon age? I mean, they probably don't belong on a ladder. And I don't know if it's
So
talk
that's
to the senior center, or, I mean, how can we arrange for people to get their batteries changed every year?
So that's a great question. I did reach out to the fire department to see if they would come to one of our meetings and do a how-to and a safety guide on how to change your batteries and keep them dust-free, and how to properly do it safely, and what services they provide. So I'm just waiting to get an email back. So hopefully in the next meeting or two, we can have the fire department in one of our meetings, so.
Okay, yes. Yeah, hopefully we don't have the firefighters on coming in to do the battery changes. Obviously, I don't think that's going to be the way to go. I'm not sure what the answer is. I'm sure most people just ignore putting the batteries in. I'm sure, understandably so. It can be tricky to get the batteries in.
Yep.
Sometimes, I guess the units
New ones
don't
are-
screw in as well, and they're tough to kind of get it in a little bit, especially on an older house.
The new multiple ones, the battery isn't even accessible. It's built into it, so you can't even. They're 10-year batteries, so you can't even get to them. So
Okay.
They
There's,
don't use batteries.
pardon? Say
Some
it-
of them, they don't even use batteries.
Oh, they all have a battery backup in
It's-
case you
yeah.
lose power. Yeah.
yeah, even if you're hardwired, you have batteries, as you say, for a backup.
Yeah.
And those batteries, when they get weak, you'll hear a little ping, ping, ping telling you ought to change the batteries. You have to have pretty good hearing to hear it. But yeah, let's see if the fire department would come in, or I don't know. Anybody have any ideas? Because there are a lot of older people in the community who are not.
Any
gonna get-
electrician would do that, could come in and do that for you, for a fee, of course.
I mean, they're going to charge $100 for the visit.
They would.
Yeah, they should. I mean, that's, they're in business.
I think we can
Know
also,
what's available.
Yeah, okay.
can also ask the senior services to maybe see if that's something, or we can put it out to some high school kids. Maybe they can make a living out of doing that, going in and changing batteries, you know?
Right, as long as there's some coverage if somebody gets hurt on your property, okay? So you have a high school kid who's, on a sports team, incredibly well coordinated, maybe the ladder is not in good shape. Yeah, so it's complicated, but we're talking about smoke alarms.
Yeah.
Yeah, see if the senior center has some thoughts on it.
Okay. I'll reach out to them also.
Anyone else, anything else on that? Any other old and new business?
One last thing. The Yarmouth Health Department is collaborating with the Yarmouth Senior Center and the Cape Cod Healthcare System. We are doing a flu clinic. They have both doses of the flu shot and the COVID is available. The newest version of COVID is available. Tuesday, October 14th, 1 to 3 at the Senior Center again. You can go on to My Chart, Cape Cod Healthcare webpage and schedule your appointment, or you can call 508-862-7000 to schedule also. Hopefully we see everybody there.
Just a couple of things that I'm going to say that are really my opinion, just being on the Board of Health, and I'm not speaking for the board. Today there was an announcement by the CDC, it's the Center for Disease Control, and we're saying that the measles, mumps, and rubella vaccines should be given, each one should be given separately and not all together. We've been giving them combined since early in the 70s. That's how long this has been on the market and followed. School kids have had to have these in order to come to school in September. They have to be up to date. So that means a person may need to bring their child 3 times for a medical appointment. And I just think that's a real hardship for people. It can be the expense of going to get it. It's taking time if, let's say, a caregiver is, or a parent is working, has to take time to get a doctor's appointment. It's also giving 3 shots to the kid instead of 1. So it's just be aware of that and stay vigilant of getting vaccines for your kid. And another point, once again, it's only my opinion, and it's not for the board. The White House announced that pregnant people should not take Tylenol when they're pregnant,
Can you
basically.
pronounce it? Can you pronounce
Acetaminophen? Yeah, I'm good. I'm better than how it came out. That's true. And that's a medication. That's the generic name, right? And Tylenol is a brand we all know about. It's a medication that's used to treat fever and pain, generally. And there are certainly serious medical problems that can develop if you don't treat fever or pain, and that could be for the mother as well as the fetus. So the message was that the Tylenol causes autism, and I'm personally not aware of any medical literature that supports that. So I just encourage pregnant women to speak with their health provider, get their advice of what to do, whether it's okay or not to take Tylenol while they're pregnant. And I would also say, if a mother has taken Tylenol during their pregnancy and they have a child with autism and they feel guilty about it, it's another reason to speak with your health provider, okay? If you're feeling upset of hearing that news, and connect with a medical expert. So once again, that's all my opinion, just as one member on the Board of Health.
Hillard,
Yes.
I thought that the MMR was not available separately anyway.
Well, I agree with you. I wouldn't know whether it does exist or it's available, but that's what the message was, and it came out today without any explanation of it. So it may not be realistic, I don't know. But it's been 50 years that this is how those vaccines have been given. So we'll see what develops, yeah. I don't know if there are indications why kids sometimes would get one or two and not all three in the combination. I don't know that.
Oh, excuse me, go ahead, Mary.
I think your advice is spot on for people to go to their own private physicians to discuss their medical needs.
One comment from a veterinarian, looking back through, we gave, there are certain vaccines that we like to give separately, but distemper, parvo, hepatitis, parainfluenza, they play very well together. And those vaccines, actually in any vaccine, the main issue that I've ever had with vaccines is a reaction to the adjuvant. And if we're talking about 3 separate vaccines, that's 3 exposures to adjuvant that could be avoided. Not to mention the adverse effect or the adverse psychological effect to these kids that are going to be getting 3 injections. I mean, I look back when I was a kid and I was really I think that's going to result in a lot of non-compliance as far as vaccines go. That's my perspective.
Yeah.
But the adjuvant and I can document that in my experience, it's the adjuvant that caused most of the reactions in dogs and cats, not so much to the actual vaccine.
Just give a definition of what that is, the adjuvant.
The adjuvant is a byproduct of the vaccine that enhances the immune response. It's there to drive, there to attract immunoglobulins and cytokines and other inflammatory mediators to the injection site so you can get a maximum response to the vaccine. And that's definitely it's been documented, it's the major cause of most vaccine reactions, at least in veterinary medicine.
Thank you.
I know in cats, for example, it's been well documented, the adjuvants were a cause of fibrosarcomas, and so we went to all non-adjuvanted vaccines for cats because of this genetic predisposition they had to this inflammatory reaction from the adjuvants. But if that was the case in humans, they would have had that well documented. And that's not the case. The other thing is, as far as acetaminophen goes, there are many, many documented cases of autism in women that never took Tylenol.
Right.
A lot of this started by one medical journal that came out years ago. The idea that about autism, and the article was retracted. Essentially, the author admitted the information was incorrect. So, okay. Anything else for new or old business? How about a date for the next meeting?
20th?
Right here.
I'm good. October 20th. All right.
This was great. You did this.
Yeah.
Great.
Okay.
Make a motion that we adjourn.
Oh, thank you. Eric,
Second.
thank you. No discussion, hopefully? Raise your hand if you want to leave. Okay.
Aye.
Okay, meeting adjourned. Thank you, everyone.
Thank you, guys.
Recording stopped.